Clinical Pilates Quick Tips. I'm Mary Thornton, and today we're going to be looking at breathing for the scoliotic spine. So often when somebody has a scoliosis, it depends on the angle of the scoliosis, but generally what will happen is one side of the rib cage will be compressed and therefore compressing the lung on that side. So the lung won't be expanding as freely as it could, and also the diaphragm, which is a big sheet of muscle, the main respiratory muscle within our bodies, can get quite tied up and quite compressed also. So the idea of this breath is that we want to open up that compressed side of the lung and also the diaphragm as well. So to know, best is to check with your clinician which side is the side that's compressed, but often you could just assess this yourself. So you can place your hands around your side and back of your rib cage area and gently take a breath in. And what you should feel is equal expansion of your ribs as you breathe. So as you breathe in, your rib cage kind of expands out to the side and the back, and then it closes back down again. Now the area, if it's more compressed, so for example if I make myself compress to the left here, so I'm leaning to my left hand side, if I try and breathe into this position now, my right lung will expand much better than my left because my left is compressed as I'm leaning to the side. So let's just imagine now that my left side is my compressed side with my scoliosis, and that's the side that I want to open for the sake of this exercise. So we need to come and lie onto our right side, because in this instance we're imagining that my left lung is the compressed lung. So I want to lie over a pillow to start with. So when you start this movement, you don't want to start with anything too severe, because it's going to be a new sort of stretch for your body, and we want to break into this very gently. So we're going to just put a long scatter cushion, soft scatter cushion, under my right ribs, and another pillow just underneath my head. And if need be, place another pillow between the knees to keep your pelvis level. Just make it a little bit comfy. So you want to use as much support as you need just to feel comfortable and relaxed in this position. If you feel uncomfortable and tense, then your breathing is going to be inhibited. So in your own time, you want to just breathe in through your nose into the side and back of your left lung. And as you breathe out, let it just sink down. Breathing into the left lung and release it down. So just breathing gradually in and out of that left side. And with each breath, just try and take a little bit more air right down into the base of your lungs. So if you think right down into the left side here, the left belly, and that just allows you to expand a little bit more. But then remember, as you breathe out, let the lung fully soften and release down. So you probably want to do sort of between 4 and 6 deep breaths on that side, and then allow your breath to come to a normal pattern again. So just breathe normally for a moment or two, and let your breathing come back to a normal rhythm for you. So if that felt okay, you can repeat again. If you've done this for several days and it's feeling easier, then we can start to progress by moving the arm and maybe the leg. So the next step is to take my left arm over my head if my shoulder feels comfortable to do so. So just stretching the arm away and reaching it over towards the wall beyond your head. And then take a breath into that left lung. And then as you breathe out, just stretch the arm away a little more. So breathing into my left lung, left belly. And as I breathe out, stretch my left arm away. Breathing into my left lung, left belly. And stretching my left arm away. And then bringing the arm back to rest. And then let my breath come back to its normal rhythm again. So the last stage of the movement is adding an arm and a leg stretch into this. So we're just going to get rid of the pillow, and I'm going to stretch my leg away from my pelvis, and then I'm going to go stretch my arm away from my body. And then I'm going to breathe into my left lung, And as I breathe out, I'm going to stretch my left leg and my left arm away. Breathing in. As I breathe out, stretch my left leg and left arm away. We can make this more dynamic if you find it's too much to hold the leg and the arm out there. We could bring it back on the in-breath, and then as we exhale, stretch away. Inhale, come in, and exhale, stretch away. And then bring it back to center again, and just breathe normally to allow the normal rhythm of breath come back. So that was just some scoliotic breathing, opening up the side that's compressed on the rib cage. So in that instance, we were imagining that my left rib cage was collapsing down with my scoliosis, so we needed to open that area up a little bit more. So we were lying on the right side because the left side was the compressed side. We're lying on a nice soft scatter cushion to start with, one for my underneath my ribs here, and then one for my head. And I popped another pillow just between my knees to stabilise or level out my pelvis. Taking about 4 to 6 deep breaths in a row, and then some normal breaths in between. It's very important that you do that. If you do too much deep breathing in a row, you'll really spin yourselves out and feel quite dizzy because you're taking on too much oxygen. So just a few deep breaths followed by some normal breaths for you. Do that for a few days first, and then gradually increase it if it feels comfortable by stretching an arm above your head, and then maybe eventually stretching an arm and a leg away. So it might feel like a bit of a stretch, but it shouldn't feel painful, it shouldn't give you pain within your back. If it does, you need to check out that this exercise is right for you. So I hope that's helped. Let me know how you get on, and see you back here soon. Thanks for watching.